Hello and welcome to a brand new episode of the Daily Debate. My name is Ahmed Nader, and tonight we're going to focus on the Egyptian comprehensive plan to upgrade the healthcare sector in the country for the upcoming years to come. But we'll be starting straight away with the main headlines and the main top story for tonight, and it comes through the activities of the Minister of Foreign Affairs, Migration and the Egyptian expatriates, Abdel, who asserted the Egyptian full support to the Syrian people and their legitimate aspirations, calling all the Syrian parties in this critical phase to put into the highest consideration the national interests and the stability of Syria. This came during Abdel's participation in the Arab Expanded Ministerial Meeting in the Saudi capital, Riyadh, on Sunday in Syria. Foreign Minister Abdel condemned the Israeli incursions inside the Syrian buffer zones and the occupation of the Syrian territories, adding that the Israeli violation to the disengagement agreement with Syria in 1974 constitutes a violation to the international law. We will be heading to a report comprising the presidential activities of His Excellency President Abdel al-Sisi over the past week, all in the upcoming report. Stay tuned.
President Abdel al-Sisi reviews the progress of projects related to the Ministry of Transport and Industry. President Abdel al-Sisi attends the Christmas celebrations at the Nativity of Christ Cathedral in the new administrative capital. President Abdel al-Sisi participated in the 10th Trilateral Mechanism Summit between Egypt, Cyprus and Greece, as well as the second meeting of the high-level joint governmental committee between Egypt and Cyprus. President Abdel al-Sisi received Mrs. Roberta Metsola, President of the European Parliament. President Abdel al-Sisi received a phone call from Mr. Antonio Costa, President of the European Council. President Abdel al-Sisi made a phone call to the Lebanese President Joseph Aoun, during which he warmly congratulated him on his election. President Abdel al-Sisi inspected the Egyptian Military Academy.
Welcome back. You're still watching the Daily Debate, and we will be heading to the first report of the episode for tonight, focusing on the main topic of the Daily Debate, which is the comprehensive upgrade by Egypt to the healthcare system, and more importantly, the presidential initiatives that were implemented according to the directives of His Excellency President Abdel al-Sisi over the past decade, and will be continuing in the upcoming years as well. All in the upcoming report. Stay tuned.
Providing a decent life for all Egyptians at all levels is what President Abdel al-Sisi sought over the course of 10 years, which is translated in the presidential initiatives and their success over the previous years to support the health of citizens and have a positive impact on health planning. At the forefront of these efforts comes the initiatives targeting the improvement of Egyptians' health, as 100 million healthy lives initiatives to eliminate hepatitis C, the initiative to support women's health, to detect tumors, the initiative to screen those about to get married. Moreover, there are the presidential initiatives to support the health of mothers, fetus, newborn children, school students, and detect genetic diseases and health care for the elderly. The health sector has witnessed unprecedented development, including the development of Nasser Institute into an integrated medical city, the establishment of a new central laboratory complex in accordance with the highest international standards, and the development of a number of major hospitals, including al-Masriyin, Heliopolis, and Coptic hospitals. Also, there are plans to establish a new heart institute meeting the international standards to enhance the role of the National Heart Institute. Ending waiting lists initiative to alleviate the suffering of those who are unable to perform urgent and critical surgeries is a great leap with the highest quality and in the fastest possible time comes at the top of the initiatives. The initiative includes heart surgeries, tumors, brain and nerves, kidney transplantation, liver transplantation, and it is completely free of charge initiative. Also, since the launch of the 100 Million Health Initiative in September 2021, 6,777,194 citizens have been examined. As part of President Sisi's initiative to examine and treat chronic diseases and early detection of kidney disease under the slogan 100 Million Healthy Lives, the initiative operates through 3,601 primary care units nationwide and aims at early diagnosis and treatment of chronic diseases and provides high-quality health services to all citizens in the age group over 40 years, in addition to the group of young people over the age of 18 who have a medical history related to chronic diseases. The initiative provides tests to measure blood pressure, blood sugar, blood lipids, kidney tests, and body mass index, in addition to providing awareness services on risk factors for chronic diseases. The presidential initiative to support Egyptian women's health was launched in July 2019 with the aim of providing early detection of breast tumors, non-communicable diseases, and reproductive health services for women, as well as providing treatment with the latest international treatment protocols for free. The cost of the initiative reached £602.9 million, where 24.6 million women were examined starting at the age of 18. Meanwhile, in terms of health initiatives to care for children aged above 2 years, school students and adults, the presidential initiative for treating spinal muscular atrophy patients was launched in July 2021 with the aim of providing treatment for children, as the cost of the treatment per child reaches $2.1 million. The initiatives also included the launch of the Presidential Initiative for Early Detection of Anemia, Obesity, and Dwarfism in February 2019. As part of the President's Initiative for Early Detection and Treatment of Hearing Loss in Newborns since its launch in September 2019 until now, hearing screening services have been provided to 4,851,000 children. The General Health Care Authority provided more than 10.5 million family medicine services through the family medicine units and centers affiliated with the Healthcare Authority in the governorates implementing the comprehensive health insurance system, which are Port Said, Luxor, Ismailia, South Sinai. Family medicine units and centers are the beneficiaries' first gateway to obtaining primary health care services in accordance with the latest approved treatment guidelines and protocols.
Welcome back. You're still watching the Daily Debate, and I'm honored to be joined in the studio for tonight by Dr. Abdel, Hady, the former Dean of the Faculty of Medicine at Mansoura University and the current President of the University of Horus. Thank you very much for being with us tonight, Doctor.
Thank you for having me.
Anytime. Of course, Doctor, we have seen a number of presidential initiatives that were implemented in the sector of healthcare under the tenure of President Abdel al-Sisi for the past decade. This is a relatively new year in the first 2 weeks of it, a relatively new presidential term as well for President Abdel al-Sisi. What to expect in this field of the presidential initiatives in the healthcare sector?
Great. Indeed, the initiatives has made great success and improvement in health in general and in particular in the domains covered by the initiatives. Nobody can ignore the value of 100 million lives that saved really hundreds of lives and millions of lives, in particular the hepatitis C, which was phenomenal. It it's going on, but the recent and most recent one is the domain in women health, which we are going to speak more because first is my specialty, and number two, women have been looking for such an initiative for a long time.
Yes.
We have had the early breast cancer diagnosis and treatment initiated many years back and proved to be very successful in detecting breast cancer, which by far the most common cancer in human being and the most common cancer in women. More recently, the domain of early cancer detection has expanded to involve cancer cervix also in women, in addition to prostate cancer in men and lung and colon cancer. Indeed, this initiative has worked very well, is still going, a bit recent, but the progress in this field, especially in women health, is also expanding. And I'm aware that the Deputy Prime Minister has met the founder of the Institute of Women Health in the States, trying to open new channels with international academia and practice for the best of women's health.
How did you see the success that we have had in the presidential initiatives? You mentioned the 100 million healthy citizens, for example, the initiative to be fighting against the hepatitis C or virus C here in Egypt, and of course the women's health. How would you assess the success of those initiatives, and is it able for the government to be building on this success?
Indeed, the hepatitis C is a success story.
Yes.
Last year, perhaps in December or even earlier, the WHO has declared Egypt free from hepatitis C, which is, you know, 5-6 years back, Egypt was #1 on the arena of hepatitis C. So
yes.
It's really
what an achievement.
An achievement. It's called a success story. And perhaps the best and foremost screening for virus C and treatment, which has made a remarkable achievement. We are hoping that other initiatives will achieve exactly the same success, and we are looking forward, but some of these are still going, some of these are beginning, as we said, the cancer detection and women's health initiatives. But the 100 million women health has proved very successful indeed.
Yes, and speaking of the health services, how do you see the success of the government to be giving those health services to the elderly and to the needy and, for example, people with special needs, for example? Do you think that this is a success in itself for the past decade?
Of course, you know, for the first time we have seen interest throughout the phases of life. If you can see, even the newborns, the hearing loss, the autism, the dwarfism, the nutritional deficiencies, and this has never been addressed before.
Yes.
Moving into the obesity, diabetes, hypertension kind of things, these are non-communicable diseases. Also, we haven't seen this in the large scale, as we say, population screening. Going into the, as we said, the hepatitis C and now the cancer detection and treatment. And there is also, in addition to all these, in what's called preventive medicine, but in the curative, the cutting close to waiting list. That has been fantastic and has achieved cure and improvement of the quality of life for hundreds and hundreds, perhaps close to 1.5 million major surgeries which has been done. So really the initiatives has made a remarkable impact on the health of the community.
Doctor, how do you see the importance of applying the universal healthcare system here in the country, and how crucial was it to be having assistance from institutions, global institutions like the World Health Organization or the World Bank, even financially, to be getting this system up and running in the country?
Oh yes, the Egyptian healthcare system has been patchy for the last, century or so. I mean, we didn't see a comprehensive insurance system as it is in more advanced countries, especially the UK, which started in 1947 or so.
Yes.
As we say, to come late, better than none never come.
Better late than
we
never,
started in the year 19, and we started with the phase 1, which the nearest to me is Port Said, and start also in South Sinai and Luxor and 5 governorates. We're on the verge of starting phase 2. Definitely, if you have comprehensive health insurance, which means that everybody will pay some minimal fees, what's called 5% or so, and this will make the budget from where the government will add more and cover those who cannot. In the aim of this is to find a space, a place for everybody in need of urgent and chronic diseases. Of course, that itself is a project for what's called social solidarity.
Yes.
And it makes more or less the 2 domains that makes people feel comfortable when improve the quality of life are health and education. And number 3 is the decent jobs. And these 3 together are called the hallmark of quality of life. So if you improve health and education and find decent jobs for people, perhaps you can raise the standard of living and the community will feel satisfied.
And Doctor, you mentioned that we already implemented the first phase of the universal health insurance system here in the country, 5 or 6 governorates. How do you rate the success of this system?
Indeed, it is under evaluation for the time being, but what I have heard and seen in the nearest governorate as Port Said, it seems working. It seems working in a good way. I've seen my colleagues and juniors who have moved to Port Said because of the better work environment, better payment, and also the possibility of practicing medicine as it should be. The value of the comprehensive health insurance system is it allows you to practice medicine in the need and in the capacity that the patient needs. I mean, there is a primary care, which everybody should go. If you need a secondary level, a slightly higher level, then you go to the second level. And if you need the tertiary, or what's called either tertiary at the Ministry of Health, big centers, or at the university, this will make people work in a designated area, in a designated field for the sake of the patient, which will never be achieved without this. As I said before with you, the problem in the big hospital is that all patients want to come to have medical care, while the majority, over 75%, should be treated in the primary health care.
They don't need it.
They don't need it.
Yes.
They do not come to the teaching hospital, big hospitals, for trivial things or minor injuries and things like that. So this stratification of medicine can make a solution for all the problems that we suffer from. It can make money and poured or invested in the primary health care, which we in urgent need. It can make the second level have its proportion, which will be 15-20%. Only 5 to 10% will need the tertiary care. So with the comprehensive health insurance, you can correct the healthcare system and avoid all the haphazard and patchy maneuvers.
And for the first phase, how would you rate the quality and the standards that we need to be reaching in terms of the services that we are giving out to the citizens or the patients?
So far, so good, but I would say we shouldn't be in a hurry to evaluate this experience.
Yes.
I did work in the NHS of the UK. They are still improving and still updating things and still merging things together, because every day they change the policy and the procedure. So
yes.
Although it is less than 5 years experience, but it seems working, and we must not be in a hurry. There is no other way, you know. Either you will go with the comprehensive health insurance till the end, where the whole country is covered, every person knows he has a commitment to care, and everybody knows that he has the right to get the health care in proper time, by the proper quality. This will take time, but it is a good start. By the way, it is getting innovation in the healthcare system as you go, because there are a lot of digitalization, a lot of consultants,
Yes.
a lot of primary and secondary healthcare facilities, and also a lot of medical equipment. I think we spoke before about how expensive are these. So it's a mega project indeed.
Yes, and Doctor, you mentioned a very important point. It is expensive.
It is.
Not just for Egypt, but for Africa and for the entire world, especially with the economic challenges that we have nowadays.
For the whole world, the cost for health, or what's called the bill for health, is #1 headache for all the governments everywhere, even in the States, in Europe, in Japan, in China, everywhere. The big headache for the government is the bill for health, because it's expanding. The equipments are very, very expensive, and it's getting more expensive day by day, especially in our situations. We need more cost-effective approach to make things done in the least expense and best benefit.
And within the realm of these economic challenges globally, not just for Egypt, is it more of an achievement to be having this universal health insurance system, this idea, and to be implementing it for the first phase and, of course, for the second phase now?
Yeah, I would say it was a very courageous step to embark on taking this mega project, because it's going to take billions of pounds, and there is no other way. You can't stop and say, I'm going to rethink. No, we are going to go. We are on the edge of another 5 governorates, and then we'll move to, this will take another 5 years or so. By 2033 we should cover, because we are keeping the best to the end, as we say, because Cairo...
2033 for Cairo, for the rest of Egypt.
For the rest of Egypt, 2033. And of course, as we go, it's becoming deeper and deeper, because we will be facing the more populous governorates. Cairo, Alexandria, and Dakhla and Sharqiya. These are coming in the 3 next phases.
That's like in 8 or 9 years. Can we do it?
Of course we can. Of course we can. With the courage I have seen, with the dedication, with the strength of ideas, with the help of the community, and with the help of international, as you said, international organization, yes, we can do. The idea is nobody is going to solve the problems, and no government is not going to, unless the government comes with the non-governmental organization and the average person or citizen of Egypt who should feel the urgent need for that initiative to go. I think things will be hard, because it's very expensive, and health everywhere depends also on donations.
And this, you mentioned a very important topic, Doctor, the help of the community.
Yes.
How did you see the response of the people, the response of the patients, the response of the citizens to the first phase of the universal health insurance system?
I think it's okay. As I said, we are waiting more objective assessment and to hear from international organizations and from our stakeholders as well. We have of course, the GHA, which assess the quality of things. The quality is okay. The expenditure so far is good. We seem to be managing, although we have ups and downs, of course. So this is expected. I would say we do not expect things to go in the full form of maturity before tens of years. And this is the experience for other people.
This is just a seed.
Absolutely. This is just the start. We will learn as we go. The first phase would be very expensive, because in the second turn, and so we can do things in an easier way at a less expense, because we had the experience. So go with determination that we can achieve.
We have this vision now. We have the directives of President Abdel al-Sisi, of the political leadership of Prime Minister Dr. Mustafa Madbouli. And this vision, do you think that this will be upgrading the services that you are giving to the citizens? Not just the services, but for the staff, for the doctors, for even the facilities, the public facilities in specific. Do you think that the public facilities for the healthcare sector, do they need an upgrade?
Absolutely. I can tell from my personal experience that the last 10 years we have seen things we never thought it would happen. We have had hundreds of major surgeries, organ transplants, cardiac valve replacement, joint replacement, for the cost of just travel to the hospital.
Yes.
Yeah, this is all funded by the initiatives. We never thought it's going to happen. You know, we have seen hospitals state-of-the-art initiated. We are seeing state-of-the-art centers opening. Last week or so, we just had the liver transplant center in Mansoura.
Yes.
And everywhere, wherever you go, you will find something coming new. The good thing is the new centers are really state-of-the-art, very advanced regarding technology. They are now looking after the whole system, including the physician, the patient, the nurse, the healthcare team, and things are going in the good direction.
So we need an upgrade for everything.
Yeah.
But how do we upgrade them? Is it just about the money, the financial resources?
Mr. Ahmed, it is never one sector. We started saying you need health, you need education, you will need money.
Yes.
Now, in the healthcare system, you need, in addition to that, the medical equipments, the medication, training of staff, okay, security, the regulation that govern all this organization is a very complicated process. And you need to tackle all these together. We are now debating the law because it is of value for the safety and confidence of the physicians.
Yes.
But also we have to think of the payment of the salaries of the nurses, why they are not paid in a good way.
And they are leaving.
They are leaving.
They are traveling.
We are facing shortage of doctors as well. We cannot ignore that because part of it is financial, part of it is work environment, and work of it is regulations. So we'll never succeed if we tackle one problem, but get the experts, sit together, have an agenda. Every problem will need many facets, many people to sit down, and we have experts. We're not short of experts. Egypt is full of experts of the best
We
minds
export
who can
them.
manage. We export them, yes. And I'm not overestimating if I said most of the Gulf states are based on the Egyptian mind.
In England and Europe and Germany.
Not a single hospital, I can bet anyone, yes. Not a single hospital in the UK.
An Egyptian contingent.
Absolutely.
Yes.
And in some disciplines it is all Egyptians working in the shift. So we will need more and more investment in health because this is the only way forward.
Yes, we will be tackling those important topics. Allow me to be going to the other report of the daily debate for tonight, as the Egyptian healthcare system will be resulting in the future for healthier and more resilient generations. We'll be having more details in the upcoming reports, so stay tuned.
Transformative initiatives are steadily taking shape in Egypt's healthcare system, driven by the strong leadership of the government of Egypt and strength through collaboration with various stakeholders, development partners and local communities. Deputy Prime Minister and Minister of Health and Population Khalid Abdel met with the founder and president of the U.S. Institute for Women's Health to discuss potential cooperation. International partners at the U.S. Institute for Women's Health and the UNICEF has played a key role in supporting these initiatives, working closely with the government and partners to improve Egypt's public health infrastructure, ensuring that children and families across Egypt have access to quality health care. With over $2.4 million financial support from the government of Canada, UNICEF has been able to extend its reach, particularly through the expanded program of immunization and improvements in medical waste management system under the leadership of the Ministry of Health and Population. This has not only impacted lives of thousands of children, their families and healthcare workers, but also significantly contributed to building a stronger, more resilient healthcare system across Egypt. With a national vaccination coverage of over 95%, the cost-effective EPI has been instrumental in controlling diseases that once threatened children's lives. Its life-saving impact can be seen in communities nationwide. The evidence of transformative changes become clear when you hear testimonials from those directly impacted by these initiatives. On such heartwarming story comes from a grandmother who brought her 6-month-old grandson for vaccination at a primary healthcare unit in Alexandria, north of Egypt. The Ministry of Health and Population played a critical role in ensuring the success of the EPI. In 2024, UNICEF procured 22 specialized trucks, 11 large and 11 small, designed for the safe transportation of hazardous medical waste. Additionally, 2 high-capacity medical waste shredders were also established, one at Abbasiyya Fever Hospital in Cairo, which specializes in infectious disease treatment, and another in Quna, a governorate in Upper Egypt. These shredders, each with a capacity of 1,500 liters, are essential for reducing risks associated with hazardous medical waste. As these initiatives continue to evolve, the future of Egypt's healthcare system looks brighter. However, sustaining high vaccination rates, strengthening cold chain infrastructure, and expanding medical waste management will require continued investment and collaboration. The commitment of parents, dedication of healthcare workers, and the support of international partners at the U.S. Institute for Women's Health and UNICEF continues to make the difference in safeguarding the health of future generations and ensuring that children in Egypt survive, thrive, and grow to their full potential.
Welcome back. You're still watching the Daily Debate, and I'm honored to be having with me in the studio for tonight Dr. Abdel, Hady, the former Dean of the Faculty of Medicine at Mansoura University and the current President of the University of Horus. Thank you very much once again for being with us tonight. And we have seen the past report, and we were speaking about a number of different and important topics regarding the healthcare services here in the country. One of them is the staff. The doctors, the nurses, people who are working in this field, and more specifically the specialized fields. What can be done to them to keep them in Egypt, to keep them satisfied as well?
Indeed, it's a very comprehensive report, but I'll just start with the visit by Valerie Harbour. This is a very well-known woman all over the world because she founded the Institute for Women Health. And she came to visit Egypt on Friday. She met the Deputy Prime Minister, and they spoke about a lot of things related to women's health, as we said at the beginning. But the US and Canada are interested in giving us their experience because they are managing a worldwide initiative to promote health of women. In their slogan, they said, if women thrive, we all do. I mean, women has a very important role in the society. In this field, I'm in this field for over 35 years, but I see things upgrading all the time. When we started, we used to say reproductive health, obstetric health, of men during pregnancy, labor, and puerperium, and gynae care. But with time, we shifted to women's welfare and well-being, and in that we added not only the medical sector but also the social, as well as education and finance and empowerment of women. So things are getting more complicated as we go. But in the report they have addressed things about medical waste, and this is a major problem. You know, every hospital knows how expensive it is to get rid of the biological hazardous waste because it can transmit microbes and things like that. So we really need, every hospital should have a safe system for transport of medical waste. I have seen the interest of the staff, as you said. Definitely the staff need approach in different ways to maintain them happy and keep them doing the job according to the standard. I would say categorically not a single staff would harm a patient. We are in the healthcare system, we are all coming to help. And the noble aim for medicine is to alleviate pain. To make the provider, or it's called the healthcare provider, starting with the worker standing at the door, till the highest specialist, and all this team works together in an orchestrated way. Everybody should feel safe and secure and working at ease to provide service with a smile, as we say. The shift working hours need to look after, because working hours, if they are heavy, long and repeated at shorter intervals, doctors can burn out.
Sometimes it's for a full day, 24 hours.
I have seen, especially in the intensive care, more than 24-hour continuous shift. The payment, to have to look at that. And I am saying I'm fully confident that things are getting better and better. And we need to take the holistic approach. I mean, as we are keen for the patient to get the best care, we're also keen for the physician, the nurses, the workers, the technicians to get also, and all this will need a more or less comprehensive planning for things. It will take money, but for that money, it should be used in the best way.
Yes.
To avoid also wasting the money for not doing the good thing. So the healthcare system, although we are on the right track, although the government is working with all its facilities, including the Ministry of Health and Ministry of Higher Education.
Yes.
We cannot ignore the role done by the teaching hospital. They are overwhelming. They are doing more than 70% of the major surgeries that we have been speaking about. And looking forward again for the comprehensive health insurance system,
yes,
that's going to rectify that one. But the healthcare coming back need to work with the international organization as the Deputy Prime Minister and as with the Minister of Higher Education meeting. I've seen hundreds of meetings with the international organization. They can help. Helping, but not only money, but they can help by training of the staff. They can help by transmitting their experience, because the learning curve, as I said before, the UK usually they get more than 50 years to know how to do things in the good in the good way, first time, least cost. That's take money. So they could help us by transmitting experience that cut short the learning curve, training some staff abroad in these high standard centers, and also by financial support. So collaboration makes success.
Mm-hmm. On the other hand, you've mentioned, Doctor, the importance of the universal health insurance system and the healthcare system in general here in the country for the benefit of the citizen, for the benefit of the patient. But does this mean that the same exact system would be in the benefit of the doctor, would be in the benefit of the nurse, would be in the benefit of the technician, the staff?
Absolutely. If you, I'm aware that the experience with both sides, as I keep repeating, it's very close to where I work.
Yes.
So I know a lot about it. The payment of the physician there is at least fourfold that everywhere. And not only the physician, but not only for the physicians, but everybody working there. And the very small fraction that the families pay, less than 5% of their income, makes a lot. So it is in itself or per se a form of social solidarity. So some people look, I'm now fit and healthy, why should I pay? Yeah, you should pay because you don't know what's going to happen
in the future,
tomorrow.
yes.
And the other is some form of help. You are paying, this is the best money to invest. The best way to invest is to invest in health and education. Without the collaboration of all sectors of the community, the rich and the poor, this system will not work as optimal as it should be.
So what is the role of the private sector nowadays?
Very good. Private sector is doing well in Egypt. I would say it's more than 50% of the healthcare is sometimes, especially in big cities, especially like the capital here, Greater Cairo, Alexandria, Mansoura even. So without the private sector, no success will happen at all. Private sector is meant for making a profit. The government is making for providing service. This should come together. Yes, you can make profit and at the same time provide your social participation as well. You can bring things that the government cannot bring in a short time.
Yes.
Especially there are some very expensive equipment. At the same time, there is shortage. For example, I'm going to give you an example. The intensive care beds, they are all occupied in all the government facilities. If the private sector can take part for that, it would be a great benefit. Again, there are some techniques that the private sector can deliver much better, especially the very sophisticated things. And the equipments as well. There are certain equipment that the private sector can, because it's an investment, as I said. But at the end, the private sector the government sector and the national sector, or non-governmental organization, which can help, can work at both sides, because they are usually working with the government, but they can also take from the private sector to work with the government. It's also, you are aware of these three circles intermingling. Unless you put things together in a comprehensive, integrated way, it's not going to work properly, You can't rely on the government for everything. And you can't put all the cost on the pocket of people. So we need the collaboration of both sectors. And I am pretty sure that the Egyptian citizens who are working at either the government or the private sector have the will to do good for the Egyptians.
Yes, Dr. Saeed Abdel Hady, the former Dean of the Faculty of Medicine at Mansoura University, and of course the current Chairman of President of the University of Horus. Thank you very much for being with us tonight on the Daily Debate.
Pleasure. Thank you so much.
The pleasure is all mine. And this brings us to the end of the Daily Debate for tonight. Thank you for watching, and I'll be seeing you tomorrow.